Hello everyone, today I'll be presenting about infusion therapy, different types of infusion preparations and their practical application. Intravenous infusion is a therapy which utilizes intravenous access to deliver medication or fluid. This may be to increase the vascular volume of the patient or deliver medication. Blood transfusion is a type of infusion. However, in this case we are transferring blood from an outside source. IV fluids can be broadly classified into two types, crystalloids and colloids. Colloids, these alter the oncotic property of blood. Crystalloids, they alter osmotic property of blood. Colloids can be broadly divided into blood products and plasma expanders. Blood in the sense the whole blood or components of blood, for example packed RBC or fresh frozen plasma. Blood products, these are plasma, these are immunoglobulins, albumin and platelets. Plasma expanders, these are for example Dextran and hexamethyl starch. They can be used as plasma expanders. They act as oncotic agents which withdraw water from the extracellular fluid into blood vessels. Crystalloids, these are basically solutes of salts. For example, they are broadly divided into three groups: isotonic, hypotonic and hypertonic. Example for isotonic solution is normal saline or lactate ringer solution. Hypotonic, half saline or half the percentage of normal saline, which is 0.45% normal saline. Hypertonic solution, these are very high these are solutions with very high concentration of solute. For example, 5% saline, 10% saline. So crystalloids they contain small particles which gives negative osmotic pressure to the blood, which allows absorption of water. So they are based on their purpose, they are divided into three groups: hypertonic, hypotonic and isotonic. Dextrose 5% water, this is an isotonic solution. It's a crystalloid that is it's usually more isotonic. However, it can be diluted and made hypotonic. It's administered for hypernatremic patient in order to reduce concentration of sodium in blood, and also for patients who have water loss, for dehydrated patients. In this case, we will be giving isotonic solution of dextrose 5%. Normal saline is the chemical name for salt. The generic name is sodium chloride. It's a sterile, non-pyrogenic crystalloid fluid administered through an intravenous solution. Normal saline infusion is used for extracellular fluid replacement. 0.45% saline or half saline. This is a hypotonic crystalloid solution of sodium chloride dissolved in sterile water. It's contraindicated in patients with burns, trauma or liver disease due to depletion of intravascular volume. Half normal saline may result in fluid overload and subsequent decrease in electrolyte concentrations or pulmonary edema. Infusing too quickly can cause hemolysis of red blood cells. In here we can see the 4-to-1 rule, which is used to identify the maintenance volume of a person. So you can see that for every first 10 kilograms we multiply it by 4 milliliter to find the volume required. For the next 10 kilogram, 2 milliliters to find the volume required. After this 20 kilogram, for each kilogram we multiply by 1 milliliter. We'll see this practically in the question. Lactate ringer solution. This is an IV solution most similar to blood plasma concentration. It is the fluid of choice for burn and trauma patients. It's used for acute blood loss, hypovolemia from third space fluid shifts. electrolyte imbalance, and metabolic acidosis. Lactate is an isotonic crystalloid containing sodium chloride, potassium chloride, calcium chloride, and sodium lactate in sterile water. It is contraindicated in patients with pH greater than 7.5, alkaline pH. Patients with liver disease who are unable to metabolize lactate, or for any patients with lactic acid acidosis. Use extreme caution in case of renal failure. Colloids, they have high molecular weight. Commonly used colloids are albumin and polyglucin. Polyglucins, these are derivatives of dextrans, which are derived from microbial enzymes which act on polysaccharides. Albumin is delivered in two type of percentages: albumin 5% and albumin 25%. Albumin 5% is initially loaded at a rate of 250 to 500 milliliter intravenously at 1 to 2 milliliters per minute in the absence of an overt shock. The time of administration of this is, the interval will be between 15 till 30 minutes. As for 25% albumin, the infusion is started from 200 to 300 millimeters. This is done in order to reduce edema. It can also be supplemented with 10% dextrose solution in order 10% dextrose solution. Dextran. This is also a colloid. The infusion rate in emergency therapy, they are administered as bolus with subsequent shift to rate of 60 to 70 drops per minute. High molecular weight dextrans are preferred over low molecular weight in anti-shock therapy. This is because they circulate high molecular weight dextrans. They have low T half, high T half-life. However, the low molecular weight dextrans, they have a half-life of almost 24 hours. The dosage of high molecular weight dextrans are 400 to 1000 milliliters. However, the dosage of moderate molecular weight dextrans are 500 to 700 milliliter per day. The infusion rate is 50 milligrams per minute, which means 1 milliliter per minute, and the maximum dosage per day should not exceed 100 milligrams. Hydroxyethyl starch. Hydroxyethyl starch is sold under the brand name Volulen. When starch enters the blood system, it converts to amylase, and due to the hygrophilic property of that compound, water, it acts as an oncotic agent. The purpose of intravenous infusion is broadly divided into 5. They are anti-shock therapy, detoxification, oxygenating agents, acid-base regulators, and nutrition. In here I have the treatment algorithm, intravenous infusion treatment algorithm, which I got from the NICE guideline. Thank you.